Most people can prevent developing type 2 diabetes. The National Institutes of Health writes on their website, diabetes prevention is proven, possible, and powerful. Medscape, a leading educational website for healthcare professionals, claims type 2 diabetes can be prevented or reversed with simple lifestyle changes. However, 20 years ago, my family did not know that type 2 diabetes was preventable and reversible, and my grandfather died of type 2 diabetes when I was just a child. Despite our family being in medical care and my grandfather's wife's and children's unconditional support, my grandfather died of a preventable and usually reversible disease because he followed the conventional diabetes treatment model of the time. Type 2 diabetes and the conventional treatment model tragically stripped our family of the kindest man I ever knew. It deeply saddens me that my children never met my grandfather. As a third-generation functional healthcare practitioner, I have learned the importance of challenging the status quo and that there is always another perspective to be considered. My combined training in pharmacology, chiropractic biophysics, naturopathic medicine, physical fitness as a sergeant in the U.S. Army, and my history of helping people transform into fit and strong minds and bodies has given me a unique perspective about type 2 diabetes. My name is Dr. Sage Haggard, and today I want to offer some sage advice for people with type 2 diabetes that I wish someone would have given my grandfather and contradicts the status quo or conventional recommendations. If you are like most Americans with type 2 diabetes who experience some of the common symptoms of type 2 diabetes, such as unintentional weight loss, extreme tiredness, increased hunger, excessive thirst, frequent urination, tingling and numbness in the hands or feet, blurred vision, or unhealed wounds, or you had an elevated blood sugar level on a blood test. You were probably given a diabetes diagnosis and some medications, either oral or injectable, to manage the diabetes symptoms or elevated blood sugar. And if you visited the American Diabetes Association's website or received some of their educational material, you were told that diabetes is a lifelong disease that causes blood glucose levels to go higher than normal. The American Diabetes Association writes that there is no cure, and I'm here to tell you today that this is simply not true. If there was no cure, then why is the American Diabetes Association's mission to prevent and cure diabetes? And then why in 2009 did the American Diabetes Association and their medical journal go on to define a cure for diabetes as complete remission that lasts for more than 5 years? Since the German Army's siege of Paris in 1870, doctors have known that type 2 diabetes could be reversed by an extreme decrease in food intake. During the siege of Paris and concomitant food shortage, doctors observed that sugar disappeared from people's urine who had type 2 diabetes and wrote about it in 1875. Instead of starving people with diabetes by eating overall less food, what if people with diabetes just ate better food? About 30 years ago, Professor Karen O'Dea from the University of South Australia examined a group of Australian Aborigines who had originally grown up in the bush as hunter-gatherers. They knew which foods to pick and gather, They knew how to make weapons to kill kangaroos and wallabies, and knew where and in what season to find both wild game and plants. But as early adults, they became westernized. They moved into small towns and cities and started to eat Western foods. At the mean age of 54, they became overweight and developed health issues like type 2 diabetes and heart disease. So Professor Odea asked the group if they would be willing to go out to the outback for a 7-week experiment and become hunter-gatherers again. They agreed. She took them out to the traditional country in an isolated location where they lived off the land as hunter-gatherers. Depending on whether the group was on the coast or inland, their diet varied, eating from 54 to 80% animal protein, 13 to 40% fat, and from 5 to 33% wild fibers carbohydrates. Lo and behold, they lost weight. The insulin resistance, the high blood pressure, the high cholesterol, everything normalized when they reestablished their former, traditional lifestyles. All this improvement came in just 7 weeks on a diet predominantly animal in origin, an average of 64% animal-based foods. And interestingly enough, exercise was not a factor in their improvements. Professor Odea determined that the group was actually less physically active in the bush than in the city. According to the Centers for Disease Control, since the 1960s, just the United States has had a 900% increase in diabetes. I don't know why more people are not terrified by that. And this trend shows no sign of slowing down. Why is this happening? Consequently, physicians caring for individuals with type 2 diabetes may find it easier to start a chronic glucose-lowering medication rather than attempting to motivate and support patients through the long-term behavior change. Even though there is no injection or pill that will reverse diabetes. In a 2015 study, dietary changes produced a 50% chance of achieving non-diabetic fasting glucose levels off all anti-diabetic therapies in 8 weeks. However, only about 1 in 3 pre-diabetic patients reports ever being told by their doctors to exercise or to improve their diets. Possible reasons for not counseling patients include a lack of resources to the physician, such as online education portals, concise nutrition books or handouts, and a lack of knowledge. We're just not training doctors how to empower the people they serve. Medical schools still mainly train crisis care and offer little education in effective ways to prevent, manage, and reverse chronic illnesses like diabetes, which requires a focus on lifestyle changes.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I probably get paid $1,500. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problem society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
Even though recent medical studies conclude diabetes reversal should be a goal in the management of type 2 diabetes, the type of lifestyle intervention that has a strong potential to reverse diabetes is not what health insurance typically covers. Insurance covers education for people with diabetes largely from certified diabetes educators who boast that their program lowers hemoglobin A1C, or the 3-month average blood sugar, by 0.6%. That is less than 1%. Let's put that 0.6% into perspective. A hemoglobin A1C is simply a measure of how much sugar is stuck to a red blood cell. It gives you a 3-month average blood sugar because the lifespan of a red blood cell is typically 3 months. If your red blood cells are bathed in higher blood sugar more often, then you have a higher percent of sugar stuck to your red blood cells. Diabetes is usually diagnosed when the A1C score is 6.5% or higher. The normal level is 5.7% or lower. So if you have type 2 diabetes and your goal is to reverse diabetes, the American Association of Diabetes Educators program reduction of 0.6% is probably not going to get you there. Especially if you're like most people with diabetes in this study that showed 63% of people had an A1C score equal to or higher than 7%, and 37% of people higher than 8%. Again, a reduction of 0.6% will not be enough change to reverse most people's diabetes. The AADE uses the National Diabetes Prevention Program because they say it's an evidence-based program. Let's review their evidence. In 1996, researchers set out to determine if certain interventions could prevent or delay type 2 diabetes, and enrolled over 3,200 adults at high risk for developing type 2 diabetes in a study. The researchers randomly assigned people to a placebo or the drug metformin or an intensive lifestyle intervention, which consisted of a low-fat diet and at least 150 minutes a week of moderate exercise, such as walking or biking. Here are the results. The Diabetes Prevention Program was determined to be a success and is the foundation for the American Diabetes Association's recommendations for people with type 2 diabetes today. However, the graph in their study shows that their lifestyle intervention does not prevent type 2 diabetes, but only delays it, because after 15 years, 55% of the people in the lifestyle intervention program developed type 2 diabetes. This program is a good example to illustrate the lack of effective nutritional education in mainstream medicine. Not understanding statistics leads to a non-transparent framing of information. Although not always intentional, non-transparency is often a deliberate tactic to manipulate or persuade people. If we take the Diabetes Prevention Program data and look at it more intuitively, such as the NNT, which stands for the number needed to treat. The American Diabetes Association's Diabetes Prevention Program will delay, not necessarily prevent, the onset of type 2 diabetes for 7 people out of every 100 people who follow the program for 15 years. Sadly, it was shown in the Look Ahead study of over 4,500 people with type 2 diabetes that almost 90% of the people failed to reverse their diabetes using the same diabetes prevention program. Did 88%, which was about 4,000 people, fail? Or did the recommended diet by the American Diabetes Association used in the study fail? If more than half the meal items at each meal, fruits, grains, and dairy, all increase blood sugar, it is not too surprising that the diet did not reverse diabetes for most people. Research suggests that exercise is associated with significant lower death from all causes and death from cardiovascular disease, chronic kidney disease, sepsis, pneumonia, and influenza in people with diabetes. However, people with diabetes merely meeting current exercise recommendations are not shown to have these beneficial effects. Only diabetic patients who exceed the current exercise recommendations enjoy the reduction of death, indicating higher exercise recommendations are warranted for people with diabetes. Yet, the American Diabetes Association recommends the amount of exercise that was shown to be ineffective for lowering the risk of complications and death in people with diabetes. When it comes to diabetes, it seems that health insurance may be more accurately called disease insurance. More examples that health insurance is better called disease insurance is disease insurance covers amputations, which there were 78,000 diabetes-related amputations in 2011.
As the wound got bigger, it got sore. I went in for some treatment. They said I was going to take my foot off. Well, it shocked me. And after the doctor told me and walked away, I got a little emotional. I cried a little bit. I'm thinking about doing that right now.
Don't want to get to the point where someone's saying we're going to have to cut your foot off.
I sucked it up, got a second opinion. And let me tell you, second opinion was good because I'm here and they've taken good care of me.
Ray's doctors chose hyperbaric oxygen therapy in an attempt to save his foot.
The oxygen therapy is worth trying. If someone said I was going to lose my foot, I'd certainly be trying hyperbaric, high-pressure oxygen therapy. But it takes a lot of time, it's expensive, it's not yet proven to absolutely work, but I can understand why anyone would want to try anything they can to keep from losing a foot.
I'm just hoping it heals good so I can get a shoe back on it and go back to a normal life. Yeah, and diabetes, not a good thing to fool around with.
Well, Ray's foot may be saved. Ray is right. Diabetes is nothing to fool around with. There are hundreds of thousands, perhaps millions, of Rays out there.
Disease insurance covers dialysis, and there were 200,000 end-stage kidney disease cases in 2011. Disease insurance covers eye exams, and 5 million people had diabetes-related vision loss and blindness in 2011. Disease insurance is not working for most patients or our country, yet most patients want only the medical care that is covered by their disease insurance. The switch in thinking and immediate change of action is critical for our nation. Chronic diseases such as diabetes are now the principal cause of death and disability, and 1 in 5 healthcare dollars spent in the U.S. goes to care for people with diabetes. Even with health insurance, diabetes can pose a significant financial burden, particularly when work is affected. Which is the reason financial advisors and gurus like Dave Ramsey say to invest in your health. There are personal financial incentives to reverse diabetes. Patients who reverse their diabetes condition can commonly save $2,000 or more in medications per year and save incredible amounts in avoiding complications of diabetes. If a person develops type 2 diabetes before age 40, they will most likely have a 15-year reduction in lifespan and a 20-year reduction in quality of life with diabetic ulcers, amputations, vision problems, and dialysis. Anything we can do to prevent or reverse diabetes is cheap by comparison.
Today is World Diabetes Day. 350 million people suffer with diabetes across the world. In the US, a new case of diabetes is diagnosed every 30 seconds. But for 85% of those people, those branded type 2, I'm speaking today to offer hope. This day last year, I was 20 stone. In the past, I couldn't get up off the sofa without crutches. I wore a horrible air boot that made me feel that things were just getting worse. I took a handful of pills for my diabetes alone. My doctor was talking about amputation, and I felt my future was looking pretty bleak. 1 year on, this week, I went to see Professor Roy Taylor in Newcastle. Following my scans, he revealed that a minor miracle had taken place in my body. My pancreatic fat is negligible, and I no longer take medication for diabetes. My long-term sugars, or HbA1c level, is normal. When I think back to my understanding of type 2 diabetes, it upsets me, because for so long I had absolutely no idea of the implications of high blood sugar, and even less of an idea that it could be fixed. Everything I was ever told, everything I ever read over the 10 years since my diagnosis told me this disease was manageable, but ultimately progressive, lifelong and chronic. I had come to accept that diabetes would shorten my life and would even ruin the life that I had left. It saddens me how many others out there must feel the same. The truth is though, that with the right family and professional support, in nutrition, in fitness, in purpose, type 2 diabetes can be halted and fixed. There is growing evidence in the majority it can even be fully reversed. My boys tell me I'm the most stubborn person they've ever met. Every time they set me a new challenge, I told them it was impossible. Cycling 100 miles? Impossible. Tombstoning? Impossible. Speaking at global diabetes conferences? Impossible. Reversing diabetes? Impossible. But in every single case, they proved me wrong. The World Health Organization projects that by 2030, diabetes will be the 7th largest cause of death. This does not have to happen. I don't know if it's a good or a bad thing that there's a whole day devoted to this horrible disease. But if the day is here for awareness, let's be aware of something important. You don't have to let type 2 diabetes rule your life. And for those who haven't developed diabetes yet, now is the time to make sure you stay that way. I changed my life. You can too.
To give informed consent, the individual concerned must be in possession of all relevant facts. Alternatives should be discussed regardless of their cost and regardless of whether they will likely be covered by the patient's health insurance. This is also from the American Diabetes Association. We've seen type 2 diabetes is reversible. So to say that diabetes is a progressive disease is simply not true. And using insulin to lower blood sugar is a good thing is crazy. My message is that people with type 2 diabetes should at least know that type 2 diabetes can be reversed with the right lifestyle changes in most people. and that drugs, and especially insulin, should be the alternative approach to lifestyle changes, and that these drugs come at financial and health costs. Only then do I believe people will be able to make true, informed consent decisions about their health care. Research consistently shows 3 key factors in reversing type 2 diabetes. First, the shorter the duration of diabetes, the better. Second, the younger the person, the better. And third, the type 2 diabetes does not require insulin yet to control blood sugar. So what does that mean if you have type 2 diabetes? The sooner you start, the better the chance you have to reverse the condition. And that means the best time to take action is now. Make a plan to at least try to reverse your type 2 diabetes or type 2 diabetes in someone you love today.